Hey guys, what's going on today? I'm going to talk a little bit about pain and discomfort in training. So I want to start off by saying that discomfort, soreness, stiffness, all those words, those can be described under discomfort. Those are a normal part of the adaptive process, meaning that after your workout, you should be sore, you should be stiff, you should be in some sort of discomfort. If you're not in some sort of discomfort after a workout, you probably didn't try quite hard enough in that workout, or maybe you did and your body's adapt to that. So now you can push your limitations a little bit further. So we're gonna start off by describing what discomfort and soreness are, but then also some warning signs as far as more describing a word of pain, being in pain. We don't wanna use discomfort and pain interchangeably. They're not really interchangeable terms. So discomfort and soreness can be described by being on both sides, meaning that usually after like wall balls and all that stuff, you're probably feeling pretty sore in both legs, not just in one leg, maybe more towards one side than the other, but still in both legs. It's towards the center of the muscle belly. So if my bicep was sore, it would be right in here. It wouldn't be towards my elbow joint. It also may appear after a change in workout intensity, duration, or modality, meaning you ran longer than you ever have before, so your legs are extra tired. You pulled faster on a rower than you ever have before, so you're gonna feel sore after that. Different exercises can make you feel different soreness and stiffnesses that you never felt before. These tend to improve after warm-up, and they'll also improve daily, meaning that when we start moving, when we start warming up, when we do some stretching, mobilizing, give it a day or so, take some rest, we'll usually start to feel better. It doesn't affect quality of movement. That's a really important one. If we notice that after wall balls, we can't squat the same because something hurts or is uncomfortable, maybe that's more of a pain. These also are generalized, meaning that they're very general statements when we talk about them. Generally feeling sore, usually our whole body will feel pretty sore the next day. When it comes to warning signs, this is stuff that we can more describe as pain, being in pain. Usually asymmetrical, meaning it's gonna be more towards one side than the other. It's also felt towards our joints, meaning after these wall balls, if our knee or towards our knee, right near our knee, really hurts, that's something that's more of a warning sign. If it doesn't improve with rest, meaning you gave it a couple days, still not feeling too much better, that's something that's more of a warning sign. If it starts to worsen after or during a workout, that's a warning sign. Make sure you be aware of that. If it affects your technique, if you can't squat as well, if you can't move like you usually can because something hurts, that's a pain, that's not a discomfort. And if it's very localized, meaning you can pinpoint a spot that it's at, your whole body isn't very sore, but this one spot hurts, that's a pain, that's not a discomfort. That's something we need to be aware of. So when you start feeling a certain way after a workout, take a second to recognize that sensation and try to use some of these factors to describe it. After you've learned how to describe it, then talk to a coach, figure out a way to train during these discomfort or painful times. There's a few different ways that we can train. We're mainly gonna talk about training during discomfort. When we're not comfortable, when we're sore, when we're stiff, let's do some isometrics, do some isolated movements towards that one side that's extra sore. Do some isolated movements, some single leg, some single arm work to get yourself loosened up, warmed up. Also do low intensity movements. If you just did a bunch of wall balls, maybe you shouldn't do a bunch of wall balls again at a high intensity. Maybe you should take some time to do some air squats, get your body moving well before a workout. Rest and sleep, super underestimated. People come in, they'll hit it hard 4 or 5 days in a row. They won't be sleeping very well in between because they'll have a busy work schedule. They're not able to recover as well. They also just don't take a day off. Sometimes it's okay to take one day off after a really intense workout where you push your limits and then come back the following day after that day of rest and be able to hit it just as hard and get that full intensity that we want during a workout. Lastly, allow your body some time to heal. Eat right. Drink enough water, drink enough fluids in general to keep yourself hydrated. Take that foam roller that you may have in the corner of your living room collecting dust, and as a decoration, take it out. Roll out while you're watching some TV. If you're watching TV already, you're still gonna be sitting down on the floor, you're just gonna be on a foam roller instead. So take some of these tips, use them to help you describe the sort of discomfort that you're in, or maybe the pain that you're in, talk to a coach, and then figure out a way on how to train through this discomfort.